Today's ABC 7 News at 6.
A tiny, flexible microscope is providing Bay Area researchers with a startling window into cancer. The technology allows them to see one of the most common forms of cancer cells while they're still in the body. Dr. Joseph Liao is holding one of the world's smallest microscopes, and he's still amazed by what he's been able to see with it.
It was wow that we were able to see individual cells live that are inside of a human being. And a deep breath.
In one recent case, that human being was Noble Cheney, an 85-year-old Navy veteran who'd come to the VA Medical Center in Palo Alto for treatment. His symptoms pointed to bladder cancer, but instead of a traditional biopsy, doctors decided to take a look around first.
Then the doctor comes in and inserts the camera in the bladder, and they have a monitor there looking all the time.
And those are, in fact, red blood cells flowing within the capillaries of the bladder tumor.
Dr. Liao is leading a first-of-its-kind study at the VA using the flexible microscope known as Cellvizio to examine tumors inside the bladder. He says the resolution is so clear that his team has been able to determine if there's cancer present even before taking a biopsy.
We can see normal cells, we can see cancer cells, and different types of cancer cells. We can even see individual red blood cells flowing inside of the patient, and the images are unbelievable.
I couldn't see what it was, but the doctor said, yeah, there's a small tumor there and it has to come out.
Doctors successfully removed Noble's tumor a short time later, but since bladder cancers can reoccur, some patients need to be re-examined every 3 months and often undergo unnecessary biopsies. Dr. Liao believes the microscope, which uses a tiny beam of laser light to illuminate images, could change how patients are treated.
Our goal is to be able to do a biopsy optically without actually invasive to have to remove a piece of tissue in a clinic setting.
The device is still investigational in urology patients, but it's already been used successfully in the stomach. As for Noble, he's relieved doctors can now peek inside his body.
Yes, they did. They did save my life because he said if it was not removed, eventually it would break down and spread to the rest of the organs. And that means surely death.
Bladder cancer.
Now, in a previous trial involving gastrointestinal cancer, researchers say the scope was able to identify cancerous tissue that traditional endoscopic exams miss about 50% of the time.
That's incredible, isn't it?